All right, folks, let's talk health. It's a topic that affects every single one of us, no matter where we live or what we do. Health is universal, but the way we approach it can be vastly different depending on where we call home. Specifically, the health of those lovable rogues across the pond, the Brits, compared to us Yanks. It's a tale of two health systems, each with its own quirks and characteristics. Who do you think is healthier in their 30s and 40s? The tea-sipping, biscuit-dunking Brits. They have their afternoon tea rituals, complete with scones and clotted cream, and a penchant for walking through picturesque parks. Or the cheeseburger-loving, super-size-me Americans. We have our drive-thrus, our all-you-can-eat buffets, and our love for convenience that often comes at the cost of nutrition. It's a question that's got more layers than a British baking show, so buckle up. We're about to peel back those layers and see what's really going on beneath the surface. We're diving in head first. This isn't just a surface-level comparison. We're going deep into the statistics, the lifestyles, and the healthcare systems that shape our health outcomes. Now, before we get into the nitty-gritty of cholesterol levels and blood pressure readings, let's take a step back and look at the bigger picture. Let's address the elephant in the room, or should I say the National Health Service in the room. The NHS is a cornerstone of British life, providing healthcare that's free at the point of use. The UK has universal healthcare. The NHS, which is basically the healthcare equivalent of a cozy, slightly worn-in pub. It's a place where everyone is welcome, and you know you'll get what you need, even if it takes a while. It's always there for you, even if the service can be a bit slow. The NHS is a safety net, ensuring that no one falls through the cracks, regardless of their financial situation. The US, on the other hand, well, that's a different story. Our healthcare system is a complex web of private insurance, public programs, and out-of-pocket expenses. Imagine a Wild West saloon where everyone's got a gun, credit card, and is fighting over a shot of whiskey, healthcare. It's a system where access and quality can vary widely depending on your insurance plan and your ability to pay. So, with that stark difference in mind, let's delve deeper into how these two nations stack up in the health department. Let's see how these two nations stack up in the health department. We'll look at key health indicators like life expectancy, rates of chronic diseases, and overall well-being. Is the NHS keeping the Brits fighting fit, or are those American vices dragging them down? Let's find out. We'll explore how lifestyle choices, diet, and exercise habits contribute to the overall health of each population. This isn't just about bragging rights, folks. It's about understanding the strengths and weaknesses of each system and what we can learn from them. This is about understanding how different systems and lifestyles impact health. By comparing and contrasting, we can identify best practices and areas for improvement. And who knows, maybe we can all learn a thing or two from each other. After all, health is a universal concern, and there's always room for improvement. So, put down the deep-fried Mars bar and grab a kale smoothie, because things are about to get interesting. We're on a journey to uncover the truths about our health and how we can all strive for better well-being. Let's be honest, folks, when it comes to portion sizes, America takes the cake. Or should I say, the extra-large triple chocolate cake with a side of fries. It's no secret that our love for big portions and indulgent treats has become a defining characteristic of our food culture. Studies show that obesity rates are significantly higher in the US than in the UK. This isn't just a minor difference. It's a substantial gap that has serious implications for public health. In fact, a recent study by the University of Oxford found that nearly 40% of American adults are obese, compared to about 28% of Brits. This disparity raises questions about the underlying causes and what can be done to address them.
Now I know what you're thinking. But John, America has McDonald's and Taco Bell. These fast food giants are practically American icons, and their influence on our eating habits is undeniable. And those giant gas station burritos that could feed a small family. It's not just about the fast food chains. It's about the culture of convenience and the availability of calorie-dense, nutrient-poor foods. And you're not wrong. The U.S. is practically built on a foundation of fast food and sugary drinks. These quick, easy options are everywhere, making it challenging to make healthier choices.
But before you start feeling smug, my British friends, let's not pretend that the UK is a beacon of healthy eating. The reality is that unhealthy food options are just as prevalent across the pond. Sure, you might have your beans on toast and your Sunday roasts. These traditional meals might seem healthier, but they can also be quite calorie-dense and not always balanced. But what about those late-night kebab shops and the endless parade of pastries in your local supermarket? These indulgences add up and contribute to the growing obesity problem.
The UK might not have the same supersized portions, but let's be real, you're no strangers to a bit of indulgence yourselves. From the full English breakfast to the pub culture, there are plenty of opportunities to overeat.
The truth is, both countries have their own unique set of challenges when it comes to obesity. It's not just about the food, it's about lifestyle, culture, and the environment we live in. The US might be battling a supersized food environment, but the UK is grappling with its own demons of processed foods and sedentary lifestyles. Both nations face the daunting task of encouraging healthier habits in a world that often promotes the opposite. It's a transatlantic tug-of-war with our waistlines, and frankly, neither side is winning. The battle against obesity is complex and multifaceted, requiring a concerted effort from individuals, communities, and governments alike. Solutions are out there, though. From nutrition education and community fitness programs to better food labeling and healthier options in supermarkets, there are steps we can take to turn the tide. Encouraging home-cooked meals, family exercise routines, and school programs that promote healthy eating can make a significant difference. It's about creating an environment where the healthier choice is the easier choice. Ultimately, tackling obesity requires a collective effort. By working together, we can create healthier communities and a brighter future for the next generation. Let's take that first step today. Now, let's move on from the battle of the bulge to the silent killers lurking within: high blood pressure and high cholesterol. These conditions often go unnoticed until they cause significant health issues, making them particularly dangerous. These two health issues are like those annoying neighbors who never mow their lawn. They might not seem like a big deal at first, but they can cause serious damage down the line. Just like an overgrown lawn can lead to pests and other problems, untreated high blood pressure and cholesterol can lead to severe health complications. And when it comes to these silent threats, it seems America is once again in the lead, but not in a good way. The statistics are alarming, and they paint a picture of a nation struggling to keep these silent killers at bay.
The CDC reports that nearly half of American adults have high blood pressure, compared to about a third of UK adults. This means that millions of Americans are at risk of heart disease, stroke, and other serious health issues. Similarly, high cholesterol affects about 1 in 6 adults in the US, compared to 1 in 8 in the UK. High cholesterol can lead to a buildup of plaque in the arteries, increasing the risk of heart attacks and strokes.
Now, before we Americans start drowning our sorrows in a vat of deep-fried butter, let's consider some contributing factors. Our diet, lifestyle, and healthcare system all play a role in these statistics. The US healthcare system, with its focus on expensive treatments rather than preventative care, might be partly to blame. Preventative care, such as regular checkups and early interventions, can help manage these conditions before they become severe. If people can't afford regular checkups or essential medications, these conditions can easily spiral out of control. The high cost of healthcare can deter people from seeking the care they need, leading to unmanaged high blood pressure and cholesterol.
Meanwhile, the UK's NHS, while not perfect, does provide free access to healthcare, including screenings and treatments for these conditions. This means that people are more likely to get the care they need without worrying about the cost. This accessibility likely plays a role in the UK's slightly better numbers. Regular screenings and early interventions can catch these conditions before they become serious, improving overall health outcomes. However, it's not all rosy across the pond. The UK still faces challenges with health inequalities, with certain socioeconomic groups experiencing higher rates of these conditions. Access to healthcare can vary, and some people may still struggle to get the care they need. Addressing these issues requires a multifaceted approach, including public health campaigns, community health programs, and policies that promote healthy living. By working together, we can tackle these silent killers and improve health outcomes for everyone. Simple lifestyle changes, such as eating a balanced diet, exercising regularly, and avoiding smoking, can make a significant difference. It's important to take proactive steps to manage our health and reduce the risk of high blood pressure and cholesterol. Remember, managing these conditions is not just about individual actions, but also about creating a supportive environment that encourages healthy choices. Together we can make a difference and combat these silent killers.
All right, let's talk about a habit that's about as welcome as a skunk at a garden party smoking. Now, I know what you're thinking. America, the land of Marlboro Man and those glamorous old Hollywood stars puffing away on cigarettes? Surely they have the UK beat. Well, hold on to your hats, folks, because the tables have turned.
While the U.S. was once the poster child for smoking, recent decades have seen a dramatic decline in smoking rates. Meanwhile, the UK, despite its best efforts, still has a higher percentage of smokers compared to the US. In fact, according to data from the World Health Organization, about 14% of UK adults smoke, compared to about 11% of American adults.
Now, several factors contribute to this difference. The US has implemented aggressive anti-smoking campaigns and higher cigarette taxes, making it less appealing and more expensive to light up.
On the other hand, the UK, while making strides in tobacco control, still has a ways to go. But let's not forget, smoking is like that friend who still uses a flip phone, outdated, unhealthy, and frankly, a little embarrassing. Both countries need to continue their efforts to stub out this harmful habit for good, because at the end of the day, whether you're in London or Los Angeles, a lung is a lung.